Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be starting with the topic protein therapeutics. We will be covering the first part of this topic in this session. Okay, so starting with the introduction, what do you actually mean by protein therapeutics? Now, what are proteins we all know, and therapeutics means when we are utilizing the protein materials or protein compounds. It can be an enzyme, it can be an hormone, or it can be any drug, any antibiotic in the form of a protein which whose chemical nature is protein for therapy. Okay, so it is currently estimated that there are about 25,000 to 40,000 different genes in the human genome. Again, something about the Human Genome Project, which I think I already mentioned in the last session. Viewed from the perspective of disease mechanisms, as disease may result when any one of these proteins contains mutations or other abnormalities. So it gives a tremendous opportunity for protein therapeutics to alleviate these disease. Alleviate means to overcome or to prevent, to get away with. Okay. So basically, protein therapeutics are where we are utilizing modified proteins or manipulated proteins to combat any disease or to combat or to manage or treat any disease which have occurred due to any particular protein mutation. And as I have mentioned earlier also, that inside our body 70 to 80% of the compounds are protein in nature, mainly in the form of enzymes and hormones. So if there is any kind of mutation in that, in those proteins which are playing a very crucial role inside our body, then obviously it will lead to a pathological condition or a disease. Okay, now coming to why protein therapeutics means, what is the utility or what is the importance, what like why at all we are talking about protein therapeutics. Okay, so proteins can, number one will be, proteins cannot be mimicked by simple chemical compounds. Okay, so for mimicking protein we need to have, or we need to come up with a protein only. Second point is that there is often less potential for protein therapeutics to interfere with normal biological processes and cause adverse effects. Now, this is something very important. What do you mean by adverse effects? Side effects that are worse, or side effects that are not good for the body. Okay. Now, any medicine, any drug, any treatment will lead to some or the other side effect. Okay. Now, when will we consider those side effects as serious? When we are seeing that those side effects are in turn causing some extra abnormality inside the body of that patient. So when a person is suffering from a particular disease, no matter what kind of disease it is, whether it is a genetic disease, whether it is a inborn disease, whether it is a form of cancer, whether it is a immunological disorder, whatever it is, whenever a person is suffering from a disease, from a pathological condition, it means that person is already, it means that person is already suffering from many side effects. Many side effects means already suffering from many disruptions in the normal physiological function. Now, when we are going to treat that disease, in the course of treating that disease, in the course of managing that disease, if the person comes up with various other extra side effects, extra adverse effects, then that is something which is not desirable at all, isn't it? Now, the advantage of, so it's very important to come up with those options where there will be no burden of extra adverse effects. Okay, so it is often well tolerated and are less likely to elicit immune responses, and that is also a very important, a feature, a very significant feature that needs to be there in protein therapeutics, because uh, whatever drug or whatever medicine we are taking, okay, whatever like therapeutical purpose we are taking inside our body, it's a foreign body, it's coming from outside. So there are always tendencies that the immune system will be, elicited, the immune system will be triggered, and the body will be starting producing antibodies against that particular therapeutic drug. And that is somewhat again something again which is unwanted, isn't it? Because otherwise, if the drug which we are taking, if our body starts producing antibodies against that drug or against that therapeutic component or compound, then obviously that compound will not be able to work, isn't it? It will not be able to perform its function. So that is again one of the important points. And next is it provides effective replacement treatment without the need for gene therapy. Again, gene therapy is something which we will be talking about in the upcoming sessions. So it's basically it's an alternative of gene therapy, because in gene therapy also we will see that there are various drawbacks and limitations, various negative outcomes are there. Okay, so protein therapeutics can also be an effective alternative for the gene therapy. Okay, and the time of protein therapeutics may also be faster. Time means time of efficacy, time which it requires to be effective. Okay. Okay, now moving forward, here we can see the schematic diagram of the regarding the history and development of protein therapeutics. Okay, so as you can see, a star is born means just the beginning, just the root of protein therapeutics. It started before 1986, many years ago. Then medical biotechnology gradually started, or more biotechnological successes were seen between the year 1986 and 1991. Then the biotechnology industry gradually developed, which occurred between 1992 and 1999. And finally, biotechnology improvement occurred since 2002, and it's still going on, obviously. Okay, now coming to the major, histological milestones as far as protein therapeutics is concerned. What are the major evolutionary improvements that occurred? Okay, so starting from 1953, the first accurate model of DNA was suggested. Then in 1982, human insulin was created using recombinant DNA technology. This is a very important aspect of protein therapeutics. Very important, not aspect, very important milestone in the development of protein therapeutics. Then in 1986, interferon alpha and muromonab CD3 was approved. Okay, muromonab, it's a kind of monoclonal antibody which I will be talking about in details in the second part of protein therapeutics. Okay, then in 1993, CBR's Office of Therapeutics Research and Review was formed. Like it's a regulatory body regarding protein therapeutics. Then in 1997, first whole chimeric antibody, which is known as rituximab, was formed, and it was the first humanized antibody, that is daclizumab, that was also approved. And in 2002, market for biotechnology products represents approximately $30 billion of the $400 billion in yearly worldwide pharmaceutical sales. And in 2006, an inhaled form of insulin, which is known as Exubera, was approved, expanding protein products into a new dosage form. Okay, now coming to classification of protein therapeutics. How we can classify them? We can classify them in 4 groups, as we can see over here. So group 1 will be protein therapeutics with enzymatic or regulatory activity. Group 2 will be protein therapeutics with special targeting activity. Group 3 will be protein vaccines, and group 4 will be protein diagnostics. Okay. Okay, now I will be explaining the remaining part of this session in the form of different tables, because then it will be easier for you to understand and easier for you to remember for long-term purpose. Okay, so the first table that I'm going to explain will be protein therapeutics, which will be replacing a protein that is deficient or abnormal. So say for example, a person is suffering from a disease which is mainly due to deficiency or due to absence or due to abnormal presence of a particular protein. Okay, now usually when a protein will become abnormal, when the structural modification of the protein has not been normal, as a result of which the protein is not being able to perform its normal biological function. That's when the protein will become abnormal. Okay, now there are various such diseases, so let's see one by one. Among the endocrine disorders means disorders due to hormone deficiency, and hormone is again a protein, isn't it? So among the endocrine disorders, first the protein that will come is insulin. Okay, so the trade name will be humulin or novolin. Function, we all know what is the function of insulin. It regulates blood glucose and shifts potassium into the cells. Examples of clinical use will be diabetes mellitus, diabetic ketoacidosis, and hyperkalemia. Hyperkalemia means increased level of potassium in the blood. Second will be insulin human inhalation, means in the form of like inhalating form of that insulin, not injectable or not drug, it's in the form of inhalating. Okay, so trade name will be Exubera. Here the function will be insulin formulated for inhalation with faster onset of action. Now what is the use, or what is the advantage of uh, producing this insulin in inhalating form? The reason behind that is when you are inhaling something, the action of that particular component will be faster than when you are taking it orally or via IV. Okay, so that is the main advantage. Again, example of clinical use will be diabetes mellitus. Then we have insulin aspart, insulin glucine, insulin lispro. Okay, the trade names will be Novolog, Apidra, Humalog. Okay, here function will be insulin analogs with faster onset of action and shorter duration of action. So the action will start with a less period of time, and the long term effect of that action will also be short, means fast acting, short duration. That is the advantage. Example of clinical use will again be diabetes mellitus. Then we have Hopin insulin. Trade name is NPH. Here the insulin protamine crystalline formulation is there with slower onset of action and longer duration of action. Means the action will start after a long period of time, but the effect of that action will be there, will remain for a longer period of time. Okay. Again, clinical use will be diabetes mellitus. Then we have insulin determined and insulin glargine. Trade names will be Levemir and Lintus. Insulin analogs again with slower onset of action and longer duration of action. Same thing as before. Okay. Clinical use will again be diabetes mellitus. Then we have pramlintine acetate. Trade name will be Simlin. This mechanism is unknown. So it is a recombinant synthetic peptide analog of human amylin, which is a naturally occurring neuroendocrine hormone regulating postprandial glucose control. Now, what do you mean by postprandial glucose control? Postprandial means just after a meal. So, just after a heavy meal, since most of our diet, particularly in countries like the Western countries, the diet is mainly carbohydrate based. Okay, so when you are having a heavy meal, say for example lunch, breakfast, or dinner, there is a spike in the glucose level, and it's very important that that spike comes under control after a certain period of time. So that is what is known as postprandial glucose control. Okay, so for that we need this thing. So clinical use will be diabetes mellitus in combination with insulin. Then we have growth hormones. Somatotropins, various trade names are there like genotropin, humatrop, norditropin, norvitropin, neutropin, etc. Okay, function will be anabolic and anti-catabolic effector. Okay, because growth hormone means it's promoting growth, so it's promoting synthesis, hence anabolic. And anti-catabolic means it will be not only, besides promoting anabolism, it will be preventing catabolism, preventing breakdown. Okay. uh, Clinical use will be growth failure due to GH deficiency, growth hormone deficiency, or chronic renal insufficiency, Prader-Willi syndrome, Turner syndrome. Okay, AIDS wasting, AIDS wasting, which happens in case of antiviral therapy, antiretroviral therapy. Okay. Then we have mecasemin. The trade name will be Increlex. It is a recombinant insulin-like growth factor which induces mitogenesis, chondrocyte growth, and organ growth, which combine to restore appropriate statural growth, means overall growth of the body. Okay. Again, examples of clinical use will include growth failure in children with growth hormone deficiency, or severe insulin-like growth factor deficiency. Okay, and last but not the least, we have mecasemin rinfabet, whose trade name is Iplex. So it is similar to insulin-like growth hormone, and it is thought to keep the hormone inactive until it reaches its target tissues, thereby decreasing hypoglycemia like side effects. So it's very important that the hormone or the protein acts only when it's necessary, only when it reaches the uh, target tissue, because otherwise it can lead to any other adverse effect which is unwanted, obviously. Okay. Example will again be growth failure in children with growth hormone deficiency. Okay. Okay, now coming to the next table. So this will explain protein therapeutics augmenting an existing pathway. Okay, now what do you mean by augmenting? Augmenting means when you are inducing or increasing the potential of a pathway. Okay, triggering a pathway. That is what is meant by augmenting. But triggering what pathway? An existing pathway, means a pathway which is essential for the body, which is a part of the normal physiology of the body. Okay, so among hematopoiesis, what we have erythropoietin. We all know what is it. Trade name will be apogen, and function will be, it will be stimulating erythropoiesis. So obviously examples of clinical use, obviously patients who are suffering from anemia. Anemia can be of different types. Okay, it can be anemia due to any chronic disease, anemia due to renal failure, anemia due to chemotherapy. Okay, then we have darbepoetin. Trade name will be arasnep. It is a modified erythropoietin with longer half-life which stimulates RBC production in the bone marrow. Examples of clinical use will be treatment of anemia in patients with chronic renal insufficiency and chronic renal failure. Means those patients who are undergoing dialysis, mostly those patients. Then we have filgrastim. Trade name will be Neupogen. It stimulates neutrophil proliferation and differentiation and migration. So clinical use will be mostly AIDS and also chronic neutropenia, or those patients who have undergone recent bone marrow transplantation. Okay. Then we have pegfosmastine. Trade name will be Neulasta. It stimulates neutrophil proliferation and differentiation. Oh, sorry. Yeah, it's the next one, but having the same function. Okay. So again, the clinical use will again be the same, means AIDS or bone marrow transplantation or chronic neutropenia. Okay. Then we have sergosmostin. Okay, trade name will be leucine. It stimulates proliferation and differentiation of neutrophils, eosinophils, as well as monocytes. So clinical use will be those patients suffering from leukemia, AIDS, or again bone marrow transplantation. Okay. Then we have oprovekin. Trade name will be Numega. It will stimulate mega karyocytosis and thrombocytosis. Means basically formation of the thrombocytes, and the megakaryocytes means the precursors to the platelets. Okay. So clinical use will be in case of thrombocytopenia, those patients who are suffering from thrombocytopenia, especially after undergoing myelosuppressive chemotherapy. Okay, myelosuppressive chemotherapy means chemotherapy after which the myeloid tissue production will be suppressed. So automatically that person will suffer from thrombocytopenia, and hence they will require proteins who will stimulate the production of these thrombocytes and megakaryocytes. Okay. Then those proteins concerning fertility, we will be having human follicle stimulating hormone. Trade name will be gonal F and follistim. Okay, so they will be augmenting the ovulation, means they will be stimulating or increasing the potential of the ovulation process. Okay, and perfect example of clinical use will be ART, that is assisted reproductive technology, which is nowadays very common. Okay, it includes all those surrogacy, test tube baby, then IVF, everything is included within this ART. Okay, then we have human chorionic gonadotropin HCG. The trade name will be Ovidrel. It will be stimulating ovarian follicle rupture and ovulation. Again, clinical use will be same ART. And we also have Leutropin. The trade name will be Livericis. It is a recombinant human luteinizing hormone which increases estradiol secretion, thereby supporting follicle stimulating hormone induced follicular development. So again, clinical use will be ART and as well as infertility. Infertility due to luteinizing hormone deficiency. Okay. Okay, now this table, the next table, this will be explaining protein therapeutics providing a novel function or activity. Novel function means something which is new, something which is unique. Okay, so let's see. Firstly, it will be including enzymatic degradation of macromolecules. So among them, we have botulinum toxin type A. The trade name will be Botox. Functions will be, it will be cleaving a particular molecule present at the neuromuscular junction to disrupt a particular complex and prevent acetylcholine release, causing flaccid paralysis. Okay, so basically important to prevent paralysis. Okay, so it will be clinical uses will be cervical paralysis, and also for some cosmetic uses. Okay, because ultimately it's nothing but Botox, and we all know what is Botox used for. Then again, botulinum toxin type B, trade name will be Myoblock. So it will be cleaving particular components, protein components at the neuromuscular junction, again to do the same thing to prevent acetylcholine release causing paralysis. Okay, so again clinical use will also be the same. Then we have collagenase, trade name will be collagenase and santile. So it is obtained from fermentation from a bacteria called Clostridium histolyticum, which will be digesting the collagen in the necrotic base of wounds. So if they are digesting collagen on the necrotic base of wounds, then what will happen? Obviously, the wounds will be cured, isn't it? So the use will be debridement of chronic dermal ulcers and severely burned areas. Okay, because severe burned areas and chronic ulcers means they are full of necrotic tissue, and that is what is we are doing over here. Utilizing this protein, we are just clearing off that those necrotic tissue by digesting the collagen with the help of this bacteria. Okay, then we have human deoxyribonuclease domains alpha. Trade name will be palmozyme. So it will be degrading DNA in purulent pulmonary secretions. So very much effective in case of cystic fibrosis. Okay, and also in reducing any type of respiratory tract infections. Okay, then we have hyaluronidase. Trade name will be amphidase vitrase hydrase. So it will be catalyzing the hydrolysis of hyaluronic acid to increase tissue permeability and allow faster drug absorption, because hyaluronic acid is basically present on the surface of the tissues. Okay, so if we can come up with something which will go and simply hydrolyze or break down this hyaluronic acid, then the tissues will be exposed and easily the drugs can come inside the body and perform their function. Okay, so basically it is used as an adjuvant to increase the absorption and dispersion of injected drugs, particularly anesthetics in ophthalmic surgery and certain imaging agents. Okay, then we again we have hyaluronidase. Just the trade name is different, Hyalnex. So the function is also same and the example of clinical use is also same. And last but not the least, we have pepin. Trade name is Acuzyme or Panafil. It is a protease from the papaya fruit. Okay, uh, so it is used for again the same thing, debridement of necrotic tissue or liquefaction in acute and chronic lesions such as pressure ulcers, varicose veins and diabetic ulcers, burns and also post-operative wounds. Okay. Okay, now moving on to the next table. So in this table, I have shown the protein, those proteins which interfere with a molecule or an organism. Okay, so let's see first cancer, different cancers. We have the first one that we have is bevacizumab. The trade name is Avastin. So the function will be, it is a humanized monoclonal antibody which binds all the isoforms of VEGF-A, which is an important molecule. Clinical use will be colorectal cancer, non-small cell carcinoma of the lung or non-small cell lung cancer. Then we have cetuximab. The trade name will be Arbitox. Function will be, again it will go and bind to EGFR. Clinical use will also be the same. Panitumab, trade name will be Vextibix. Again, more or less the same function. Clinical use will be metastatic colorectal cancer. Okay. Then we have rituximab, very important. It is a chimeric monoclonal antibody which will bind to a transmembrane protein found in about 90% of B-cell non-Hodgkin's lymphoma, and it is having a synergistic effect with small molecular chemotherapeutic agents which have been demonstrated in lymphoma cell lines. So obviously clinical use will be B-cell lymphoma, non-Hodgkin's lymphoma, etc. Okay, and then we have trastuzumab. Trade name will be Herceptin. It is again a humanized monoclonal antibody which binds with certain cells surface receptors, and thereby it controls different cancerous cell growth, particularly breast cancer growth. Okay. Okay, so this this chart again explains those proteins that deliver other compounds or proteins. Okay, so I will just talk about the important ones. So at first we have denileukin. Trade name will be Ontak. So the function will be, it will direct the cytocidal action of diphtheria toxin to the cells expressing the IL-2 receptor. So basically clinical use will be those persons who are suffering from T-cell lymphoma. Then we have ibiturumab. Trade name will be Zevalin. Again, it's a monoclonal antibody. See, whenever we have a name which is ending with MAB, it means monoclonal antibody, because MAB is the short form or the abbreviation of monoclonal antibody. Okay. So this is used in case of again B cell non-Hodgkin's lymphoma. Then we have Gentuzumab. Trade name is Myloturg. Again a humanized monoclonal antibody used as a chemotherapeutic agent. So what type of cancer? Any type of acute myeloid leukemia, okay, which is abbreviated as AML. Different types of AML are there, so that's why I mentioned any type of acute myeloid lymphoma, okay. Sorry, leukemia. Then we have tocilizumab and trastuzumab, again two monoclonal antibodies. Trade names will be Bexer and Bexer I-131, okay. So it basically it's utilized for delivering cytotoxic radiation. So what type of cancers it will be used in? It will be used in again any type of cancerous growth, follicular cancerous growth, okay. Now coming to some of the protein vaccines, okay. So those vaccines, starting with those vaccines who are protecting against a deleterious foreign agent, okay. So for example, hepatitis B surface antigen, which will be giving us protection against hepatitis B. So the clinical use will be hepatitis B vaccination. Trade name will be Engeris and Recombivax HB. So it is a non-infectious protein on the surface of hepatitis B virus. Then we have HPV vaccine, that is human papilloma vaccine. The trade name will be Gardasil. So again it will be clinical use will be prevention of HPV infection, okay. So it is a recombinant vaccine which will be containing the major capsid proteins found from the major 4 HPV strains, okay. Then we have OSPA, trade name will be Limerix. It is a non-infectious lipoprotein present on the outer surface of Borrelia burgdorferi. So it will be preventing the disease caused by Borrelia burgdorferi, that is Lyme disease. Okay. And then coming to treating autoimmune disorders, we have anti-rhesus immunoglobulin G. Trade name will be Rofilac. So what it will be doing, it will be neutralizing the Rh antigens, rhesus factor, we all know what is it, which could otherwise elicit anti-Rh antibodies in an Rh negative individual, which is a very important issue which is seen in case of those cases where the newborn baby is Rh positive but the mother is Rh negative. So there is a mixing of the blood. So when that same mother again becomes pregnant and again the child is Rh positive, so the Rh antibodies which have been formed inside the body of the mother will now go and attack the second newborn baby, as a result of which the baby will suffer from hydrops fetalis, and it can lead to, eventually it can lead to death of the baby, which is known as erythroblastosis fetalis, okay. So for this particular condition, we can go with these protein therapeutics. I think this is some of the last slides of this session. So we have protein diagnostics. So various proteins we can also use for diagnosing various conditions, like for diagnosing in vivo infectious disease. We can use recombinant purified protein derivative DPPD. So it is a non-infectious protein which is isolated from Mycobacterium tuberculosis, and obviously it will be used for diagnosis of TB. Coming to hormones, we can utilize glucagon. Trade name will be glucagen. So we all know what is glucagon. It is a pancreatic hormone which is performing antagonistic function of insulin. Means it is, instead of uptaking glucose into the cells, it is increasing the level of glucose in the blood. Okay. So again, it can be used for diagnosing hypoglycemia. Then we have growth hormone releasing hormones. Trade name GERF. It is a recombinant fragment of growth hormone releasing hormone which can be used for diagnosis of defective growth hormone secretion. Then we have secretin, which is a human peptide used for stimulation of pancreatic secretions and gastrin. It can be used for diagnosing pancreatic exocrine dysfunction or gastrinoma or different cases of pancreatitis. And we also have thyroid stimulating hormone. Trade name will be thyrogen, which will be stimulating thyroid epithelial cells and can be used as adjunctive diagnostic for serum thyroglobulin testing in the follow-up of patients with well differentiated thyroid cancer. So this is basically a chart, a pie chart kind of a thing, which is explaining the protein therapeutic cells by category in the year 2008. So see, vaccines are celled around 13%, miscellaneous is 1%, antithrombins means blood clotting factors will be 11%. cytokines will be 19%, growth hormones will be 2%, hematopoietics will be 23%, insulin will be 5%, and monoclonal antibodies will be 20%, plasma proteins will be 6%. Plasma proteins will include albumin, globulin, okay, the different immunoglobulins will also come. So biologics already account for 12%, which is giving an estimate of about more than $60 billion of total pharmacy sales. Pharmaceutical companies will be having invested heavily in production capacity that needs filling and acquisitions accelerate. So this is basically a chart which is showing different protein therapeutics which are already in the market in the US and Western Europe. Okay, so they have just given the different company names, brand names, the generic names, the classes, and an estimate of how much financial estimate it has made. Okay, so there are different classes of protein, as you can see: erythropoietin, interferon, insulin, colon stimulating factor, interferons, growth hormones. Okay, so more or less all the major categories of proteins that are there. Now there are some disadvantages also that may limit their more widespread acceptance, which will include low oral and transdermal bioavailability. Moreover, injections must be given frequently because half-lives of proteins are short. Okay, so the shelf life or the half-life is less, so the injections must be given at a more frequent interval. So that is one of the disadvantages. So I think that's it about the first session of protein therapeutics. In the next session, we will be talking about monoclonal antibodies, which is a major important part of protein therapeutics. Till then, goodbye. Please like, share, and subscribe ITLS Academy. Thank you.